Good afternoon, everyone.
Good afternoon.
Thank you all for coming. I'm so happy today. I'm so excited to be here in this place in particular because this is where I graduated from. So it's a very, it's overwhelming to be back here to bring a little bit about everything that I have been learning. And so it's just a huge privilege, and I'm very happy to be here. But I see a lot of familiar faces. Thank you so much for the support. But for those of you who don't know me, my name is Elayne Rosa. I'm originally from Brazil, and I'm a wife, a mother of two young men, 25 and 26. So that makes me 47, I'll be 48 this year. So I have a little experience that I want to share with you today, okay? And as a massage therapist, I specialize in manual lymphatic drainage and post-op care. And I got interested in this field because I was a patient myself. I'm a breast cancer survivor, and that's actually where my story as a massage therapist began, because it was during this period that I really learned how important it is to understand the body, to help the body heal itself. It was during that period I had some complications, and I had to have eight surgeries. So it was during that period also that I learned how important it is, the intentional touch, how intentional touch can really reduce pain. And that was the reason why after I got better, I decided to become a massage therapist. During this period when I was feeling a lot of pain and it was hard to sleep, even with pain medications, my husband trying to help me to feel some relief, he would touch my back, and that would actually reduce the pain. And I was able to sleep a lot of the times with his touch on my back. So that's how I got to think about how important touch is and how it can make a difference. So I came to this school here, PMTI, and this is where I learned even more the importance of understanding the body so we can be intentional about helping our patients. So I think this is the big word that I want to bring for you today. Because when we understand what the body needs, we can be intentional about helping the body to achieve better health, right? And so on my clinical practice, I have been working with post-op patients a lot, and I also have noticed the difference that from the people that understand a little bit and from the people that don't, how recovery is so different. Recovery can be so much faster when you give the tools for the body to heal itself. And besides my clinical practice, over a year ago, I decided to do a plastic surgery myself. I wasn't happy with my body. I was gaining weight and I wasn't being really able to control it. And I decided to do a liposuction. So I scheduled the liposuction, but knowing and understanding that I needed to help my body be stronger for the surgery, I went to search for doctors that could help me prepare for the surgery itself. So I had taken some continuing education classes in Brazil for post-op techniques. And there I heard that in Brazil, there were some doctors that were using integrative medicine to prepare their patients for surgery. So, the work of the plastic surgeon would be, they could see the results much faster. And actually also the complications that might happen on the surgery, they noticed that it was decreased because the body was stronger. So I reached out to them and to prepare my body, and then as they were taking me to the steps that I needed to do to make my body stronger, I learned that I have a chronic disease called lipedema. And I want to bring you this information also as awareness, because a lot of people have this disease and have no idea about it. So as I was preparing my body to get stronger, I realized that I was actually taking care of this disease. So let's learn a little bit about the disease itself. Lipedema is a chronic inflammation of the fat cells and connective tissue. So a regular fat cell is different from a fat cell that has lipedema because it's bigger and it's harder and it's painful. I always felt like my legs were bigger than normal, and I always felt soreness, but I understood that everybody had that sensibility. So learning about this disease, I learned that fat doesn't hurt. So this is why I want to bring this information for you, because this disease is genetic, so I was born with this disease. But using what I want to bring for you today, the 8 natural healers, throughout my life, I was actually controlling this disease, because it's a disease that is progressive also. It has no cure, but it has treatment. And because I had the privilege of growing up hearing about the 8 natural healers and using them, I was actually controlling it without knowing. And I realized that the past few years, I wasn't using it as much as I used to. So my disease was actually progressing because it's hormonal also. So when you have a hormonal imbalance, you can get triggered and you can start to progress. So here in the U.S., even though the doctors in Brazil were helping me, guiding me to what to do to get inflammation down on my body, I was diagnosed by a doctor here in the U.S., in California, because it's hard to find a specialist on this disease. So I had a consultation online with this doctor, and he actually diagnosed me with stage 2 already. And I want to go back to my picture there, because this is 2 months apart. And you can see the huge difference using the conservative treatment, which is reducing the inflammation. So I was able to actually take my disease back to stage 1, right, just by using the 8 natural healers. But they were actually just getting my body stronger for the procedure that I wanted to do, and I didn't know that I had this disease. So this is me after using the 8 natural healers. And it's not about losing weight, but decreasing inflammation, feeling less pain, because that's what I really gained. Because I used to feel pain in my legs, and I used to, by the end of the day here, I want to go back there again. Because this picture here, I was on vacation. It was 10 in the morning, and the other picture there, it was 7 at night. It was a summer day still, but it was 7 at night after I had worked all day on my feet. And before that, I used to joke around that I had 4 legs, because by the end of the day, my legs would be so swollen. And that wasn't happening anymore because I was using the 8 natural healers again. So we're going to talk a lot, and we're going to have a little experience about using the 8 natural healers here today also. And I want to bring to you also Dr. Juliana, because she was one of the doctors that helped me through the whole year to go back to using the 8 natural healers. And she was supposed to be here today, but unfortunately she's not. But she's coming this year, and all of you are invited to come back and meet her when she's here. But she's here in a way because I'm going to be sharing with you all everything that she has taught me, okay? But she's wonderful. She became a friend, and she's really a mentor. She's one of my instructor also on post-op care because that's her specialty as well. So we're going to start going over the 8 natural healers. And as a massage therapist, I have to start with rest. Right? So what is rest? Are you really resting? Do we really allow the body to rest? And that's the thing. And I want to start with taking you to think about the nervous system, right? If we take out all the systems in our bodies and we leave just the nervous system, you're going to be able to see the whole human being, right? Because the nervous system is everywhere. Everywhere you touch, right? You can feel it because the nervous system is there, right? And the nervous system, we have the autonomic nervous system, which means that we don't really have control over it, but we can influence it. So, and when we know, we can be intentional about allowing those two systems to turn on and turn off. So, the autonomic nervous system, we have the sympathetic system and the sympathetic system. The sympathetic system is the system that releases hormones for you to learn, for you to solve problems, right? And like they say fight and flight, or flight, right? So it's the system that gets you ready to do everything. But nowadays we are always ready to do everything, right? So basically, oops, sorry. So basically, we are always on that system. And the parasympathetic system is the system that releases hormones for us to rest and digest better and well. So we don't really have a problem with not moving a lot, right? So we can rest, we can be sitting or laying down, right? But we're not really resting because our mind is always working, is always worrying about things. So we can go to bed, for example, and be thinking about so many things that we're not really allowing the body to go and really relax and rest. So most of the time, we actually fall asleep because we are exhausted, right? So if this happens, the body really is never going into that deep sleep where the body can heal itself. So this is one thing that I want you to think about, because if we are allowing ourselves to fall asleep because we are exhausted, then we are also never allowing the body to restore, okay? So especially for post-op care, when we are dealing with an injury or just healing from a surgery itself, it's crucial. I cannot tell you enough how many times I see a patient and they're not being able to sleep and they are in so much pain because they're not able to sleep. But when we start talking about it, it was hard for them to sleep even before. So it's crucial for us to understand this so we can start helping the body to be stronger before we do a surgery, or when we are healing from an injury, for example, right? Let's take a look what it says here. Quality sleep is crucial for post-op surgery or any healing, because during deep sleep is when the body is able to release hormones, growth hormones, right? So that's when actually the body will be able to repair tissue. So if we weren't sleeping before and now we are not sleeping because we are in pain and it's difficult to really sleep, we can see how the healing process is going to take much longer, right? So this is one thing that I want you to think about, because during deep sleep is also when the immune system gets strengthened, right? So poor sleep can increase pain and slow down the whole healing process. So thinking about being intentional on our care, I want you to remember to create an atmosphere where at night, when you can really allow the body to understand that you can relax and you can let go, but especially the mind, So start creating an atmosphere. Studies say that if we sleep around, not much later than 10:30 is when the body can really go into that deep sleep that will restore the cells itself. Okay, so it's very important to start creating the atmosphere. So around 10:30, we can actually be able to fall asleep and to go into that deep sleep. Because if we're sleeping and not being able to go into that deep sleep, the body is really not recovering like it needs to. So be intentional. Therapeutic massage, and remember what I said about my husband touching me and helping, trying to bring down my pain. That was really happening. He didn't know anything about massages, right? I didn't know anything about therapeutic massage. But it's the intention that really can help someone. And when we know we have the information, we can be intentional. And we can be intentional about our own care. So make strategies to help your body to be able to go into that deep sleep. Okay? Therapeutic massage, the touch, can really allow the muscles to release tension. So at night, you can sleep better. Okay? And I want to bring this study because when I found this, it was amazing. This study was done at Emory University in Atlanta, Georgia. I have a short version of the video, but you can go online because it's on YouTube, this whole study, so you can see. But it's amazing what they were able to see in a cellular level, what touch can do. So let's watch.
It's the fourth such study in 9 years, each one showing the surprising power of massage to help different conditions.
I tend to be really skeptical about stuff. And so here was this entity, massage, and people were spending billions of dollars getting massages. And when I started to read about it, I said, well, what's it doing?
Dr. Mark Rappaport, the head of psychiatry at Emory, launched the first study to see how just one massage affects the body, with participants getting either Swedish massage or light touch.
So even in unstressed young normals, we saw that massage increased the number of lymphocytes and increased the number of lymphocytes that actually white blood cells that had a marker for what's called the innate immune system, NK cells.
A single Swedish massage in a healthy person, giving the immune system a boost and lowering stress levels. The next study was with people with generalized anxiety disorder. After twice-a-week Swedish massage, participants reported significant decreases in measures of anxiety and depression, and those results lasted months after the study ended.
Fatigue may be related to a low level of chronic inflammation. Do men with a very different type of cancer also with fatigue respond?
After 6 weeks of massage,
oh, I feel like my old self.
I think that massage is changing and modulating our immune system in a way that decreases sort of the chronic inflammatory states that occur in certain disorders. We're seeing a decrease in inflammatory markers associated with these cancer survivors who've been plagued by chronic fatigue. We need to do more analysis there, but it looks very, very positive.
making a powerful connection
I could not do this before.
that massage impacts not just the body, but the mind.
Our body influences the brain, just as the brain influences the body.
It's amazing, isn't it? It's not just about relaxing, right? It's about strengthening the immune system. It's just amazing, right? So talking about post-op care, I want to take you to a case that I had. And unfortunately, I want to bring this awareness because I have had patients like this too many times. They received, because we learned how touch can really help the body, but the wrong touch we know that can harm the body as well. Right? So this story is very emotional because this patient came with her friend, and I thought she had the surgery a few days before because she was in so much pain and she couldn't really walk. And when the friend ended, put her in the room and stopped helping her, she looked at me and she said, "I'm not going to stay because I can't stand the screamings." And I said, "Well, but nobody's going to scream here." And then she told me that she was going actually to, because on the internet people learn that they have to have so many massages after surgery. So she was going for already almost 3 weeks to receive those massages that she understood that she had to, because after plastic surgery they had to receive so many massages. And it was so rough because you can see there that she already had fibrosis developing, right? So I explained to her that she could stay in the room and watch me work because her friend would be feeling good and she wouldn't scream, I promised her. So it was very emotional because then when she saw that her friend was feeling less pain already, she started crying and praising God. So, and this is what I was able to get herself back to. So we do in post-op care, it's not just manual lymphatic drainage. There's other techniques that we use also to help, but they should never hurt. So after some sessions, we were able to get her back, and even the first session, we were able to reduce her pain. So what I want to do with you guys now, as a little demonstration and practice, I want to take you guys a little bit. Please open your folders. There's a flyer like this on your folder where you can see the lymphatic system. Okay? So the lymphatic system, you see it?
Yes.
You found it? Yeah, so you're gonna see this little picture there, right? This is the lymphatic system. So different from the circulatory system, for example, the lymphatic system doesn't have a heart that works as a pump for the lymphatic system. Because the lymphatic system is the drain for our body, right? So it needs to move. When we have an injury or surgery, there's lack of movement, right? So it's hard for the lymphatic system to do its job because there's no movement. If you think about, most of the lymph nodes are placed right on our joints. So there we can visualize how movement is really the pump for the lymphatic system, right? And during the manual lymphatic drainage, the hand is working as a pump for the lymphatic system. But we are stimulating the superficial part of the lymphatic system. So the vessels are very gentle and they're very fragile. They say that it's as thin as a fine hair. So with that in mind, you can visualize how the touch needs to be able to be effective, right? So rough massages doesn't make sense, right? And besides that, the right touch, a gentle touch, can reduce pain. So I want us to do a little exercise so you can feel
Marcelo João dos Santos.
Something that you can do for yourself to start stimulating movement of the lymphatic system, okay? So remember that this is the area where the fluid needs to come up to, right? So you can use your right hand, maybe on the opposite side would feel better for you. And then you're gonna move, because it's a movement of the skin. So you can take a look at me and how my skin moves. You being able to see? So really feel the palms of your hand and the skin touching your hand and really moving the skin in a gentle motion. So you're going towards your ears and then down your neck. Okay? And again, being very gentle. So try maybe to do a cross if it feels better. Okay? And then bring it down to the clavicle. And there you can do a little pump as well. And this is something that you can do every day for you, and even when you are recovering from surgery or from an injury, this is a way that you can start stimulating the lymphatic system to move, okay? And feeling this, you can imagine that rough massages right after surgery doesn't make any sense, right? So I wanted to bring you this information so you don't allow this to happen, okay? So I can demonstrate if anyone wants to get on the table for me also. I can. So anyone, if you want to get on the table,
Go ahead.
This is how I like to start my sessions again, especially because the patient is in pain, right? Usually after surgery. So this will calm down their nervous system. And we can stimulate here the lymph nodes. Like I said, there's a lot of lymph nodes around the neck, right? And remember, all the fluid needs to come up. So stimulating the main ducts here of the lymphatic system, you can start actually to improve the whole movement of the lymphatic system. Okay. There's a lot of lymph nodes on the occipital region, right? And this is something that you can do on yourself. So remembering, thinking about the lymph nodes here, and that the main ducts of the lymphatic system is right above the clavicle. This is something that you can do every day on yourself. Because if the lymphatic system is the system that cleans up the body, everybody should be stimulating the system and helping it on its job, right?
Great job.
go to our next natural healer, which is fresh air. Are we really breathing? It's funny, right? Because we need oxygen to live, right? But it's funny to think that when we start learning and being intentional about breathing, we realize that we forget how to breathe. Isn't that true, Tim? We really forget how to breathe. And it's funny because sometimes when I ask my patients to take a deep breath in, and they're on the table, there's no movement at all. So I wanted to bring you this information so you can really be intentional about your breathing as well, okay? Because that makes a difference also on the lymphatic system. Because remember, the lymphatic system moves with movement. So when you are inhaling and allowing really the body to move, you are giving that little pump for the lymphatic system to work. So you are stimulating your lymphatic system when you take a deep breath in. There's a lot of lymph nodes on your abdomen, and one of the main ones is right next to the diaphragm here. So taking a real deep breath in, you are stimulating the lymphatic system. So we're gonna watch this video so we're gonna understand a little bit about how is it that we forget. We grow up and we forget how to breathe. So let's watch.
Take a deep breath. If you feel like you're going up and getting a little bit taller, you're breathing so wrong. Breathing wrong is when you use your neck and shoulders to pick up your thoracic cavity. So do this now. Take a deep breath and watch. If you feel like you're going up and getting a little bit taller, and then you come down and settle down on your exhale, that's actually a dysfunctional breath. At 5 and under, I found that most kids breathe perfectly. So a number of things happen so that when you ask a 10-year-old to breathe, they start breathing with that upper body breath that's actually anatomically incongruous and leads to us being in fight and flight, more anxious, having neck and shoulder pain, not being able to sleep, and having digestive problems. So how did we get there? Number one is that child starts sitting a lot. They start going to school. We sit way too much, 13 to 16 hours a day. Number two is injuries. If you're a little kid and all of a sudden you start skateboarding or skiing, anything that hurts the middle of your body, you immediately stop inhaling and expanding because it hurts. And your breath goes all the way up here to be an upper body or a vertical breath. You start wearing waistbands, bra straps, compression garments. You start sucking in your gut, and all of a sudden that breath that was perfect before you were 5 turns into a dysfunctional one as an adult, and it stays there until you fix it right now. A good breath, a breath that's anatomically congruous, that goes with the rest of your body, is that you inhale and you expand your body. Neck and shoulders don't move. You expand all the way around, 360 degrees. You come forwards a little bit, your sides open up, and even your back opens up. And if you want to see what this looks like, look at your dog, your cat, your fish, any animal on the planet except for us, and you'll see them breathe perfectly. 360 degrees all the way around, expanding on the inhale and contracting, wringing out, getting narrower on the exhale. No neck and shoulder movement.
Isn't that amazing how we forget how to breathe, right? So I want to see everybody moving now. Taking a really deep breath in. And she talked about garments. And when we're talking about post-op care, Garmin is one tool that we need a lot, right? And I want to show you another case that I had because it shows you how much compression really matters. So this patient here, she came to me 3 weeks post-op, and she was wearing a very, very tight compression because that's another wrong information that unfortunately they get out there. They understand that they need to compress too much, and we need air for everything, right? And especially after surgery, you can't compress too much. So you need the right compression because there are space between the tissue and the skin itself, so you don't want to allow fluid to build too much and just stay there sitting on the tissue. But for that, you need the right compression. So the compression needs to still feel good and feeling that it's supporting you, okay? So this patient, after 3 weeks, she was in a lot of pain, developing also fibrosis, and actually the folding of the skin because the compression was so tight. So we were able to work with her and get her to a better place again, but what we're trying to do is to avoid that. So I brought for you some compressions so you can feel the difference, because you need the compression, but there's 2 types of compressions right after surgery. So the first week you need some compression that will give you support, but not too much, okay? And I want to pass it over so you can feel the difference on the compressions. I have two box here. So this first one, you can feel the compression, and this would be the second one, because it has a little bit more compression, but then it's not making you hurt anymore. And the folding of the skin, that's why the foams that you see in that box, I'm gonna pass it over here. The foams and the boards are to help prevent that folding of the skin. So that's why you need them, especially in the beginning, with the right compression, so there's no folding of the skin and there's not too much space also for fluid to build up. So the black one would be for the first stage. So this one here would be for stage 1, and the other one you can feel the difference on the compression there. You can tell the difference. So we're going to go to our next natural healer, which is water. I love water. I really drinking enough water, because water is another item it's another thing that really helps the lymphatic system. When you go and take a class with the lymphatic system, the first thing that you learn is to drink enough water, because otherwise the lymphatic system won't work. So, are you tracking your water? I have some of my patients here. And you guys know that I always ask if you track how much water you drink, because if we don't track, we really don't know if we're giving enough water for the body to actually function well, right? So, and we need water for everything in our body, right? Because it's the transportation, it's the way that the body actually can bring nutrients and can bring oxygen for the tissues. And when we are healing from anything, and when we are especially healing from surgery, we want every cell to receive the oxygen and the nutrients that it needs, right? So on your folders, you have everything, because I wanted you to have it in hand to go and take a look and see how important it is. Why do we need the water so much? Because it influences everything, especially the gut. And after surgery, we have a lot of people that have problems after the surgery because the gut stopped working, right? And one of the things that we can prevent is making sure that we are hydrating before the surgery so the gut will continue to work well. So you also have this information on your folder, because how much is enough, right? How much do I need? We hear 8 glasses of water, right? But that's general, and it's per body weight. So this is why I brought to you on your folders, so you can know how much water you need to drink every day for your body to function well. Okay, and this is a calculation that study says that it's the minimum water that we need. So if you think that it's the minimum when it's hot or when we exercise, or depending on what we eat, we're gonna need more water, okay? So what I like to tell my patients is to start the day hydrating. Because if you think about it, you went probably around 8 hours without drinking anything. So we all wake up a little dehydrated every day. So starting your day with a glass of water can really be a nice way of waking up everything, all the organs in our bodies, right? And hydrating ourselves. For my patients that are healing from injuries or from surgery, I also recommend to add some amino acids to it as well. Fresh lemon that can really help detox the body, right? Because after during the surgery, we also had a lot of toxins in their body because the doctors needed to use medicine, right? So the water is the water is the agent that can help us detox the body. So I encourage you to start your day with a glass of water. Okay? And I love water inside and out. It's really healing. It's healing waters, I would say. For those of you who are my patients, you guys know that I like to bring the hydrotherapy with the warm towels, right? So I brought them for you guys today, so we can do a little demonstration on hydrotherapy. But one thing that I like to point out, especially for my patients that had surgery, is to remember to hydrate the skin. And I always recommend essential oils because you can bring nutrients also through the skin. Okay? So really make sure that the skin is very hydrated before your surgery. Okay? So who wants a little hydrotherapy now? You want some? Go. You can put it around your neck, or if you want to put it on your feet as well. Still. Everybody wants a hot dog, huh? We have a glass. Let's get. Thank you. I was looking for my husband. No. You gonna help? Thank you. the White House. Hi, Dr. B. Thank you for coming. Dr. B, what do you Everybody had the experience? Huh? Did you get one?
I'll take one.
Isn't it wonderful? Can you feel how therapeutic it can be? How it really is a natural healer, right? Inside and out, right? So we're gonna go to our next natural healer, which is exercise. Exercise. We were created to move, right? And when we think about what the body is able to do, it's amazing, right? All the joints, right? What it's able to do, it's wonderful. And now, nowadays we don't move as much, right? So I want to encourage you to be intentional about exercising, especially before your surgery, because exercise can strengthen your immune system. And like I told you in the beginning, with my clinical experience, I have noticed how different people recover. People that understood a little more the importance of strengthening their body, using the 8 natural healers, how it makes a difference on recovery. So exercise needs to be fun. It has to be fun because we were created to move. So make it fun. It doesn't have to be too much. Just, if you're just starting, start with 10, 15 minutes every day. Right? That will really strengthen your immune system. But I want you to think that it needs to be fun. So make it fun, okay? 30 minutes every day is what will actually help you to have better health. But if you need to start small and be happy with what you are able to do, okay? So also on your folders you have this information because I want you to think about that choosing to use one natural healer, you can actually use all the other 8 natural healers. And I want us to go through them now, because if I decide to go for a walk today, for example, I'm gonna actually rest better this evening. I'm gonna be able to fall asleep a lot better if I choose to go for a 15-minute walk. If I start with 15 minutes, okay? So there you already have 2 of the 8 natural healers, right? And if you are outside walking, you're gonna take fresh air. So there's another natural healer right there, right? Water, you for sure will remember to drink water, right, if you go for a walk. So you have the other natural healer right there. The sunlight, we're still going to talk about sunlight because it's one of the 8 natural healers as well. And if we go outside, we're going to be able to be exposed to sunlight. Nowadays, we don't get exposed to sunlight as much. And it's a wonderful natural healer, okay? Moderation, we're going to talk about moderation as well, which is another natural healer. Because exercise, if you exercise too much, you can injure yourself as well, right? So we're going to go over moderation because it goes for everything. But you can use moderation also if you choose to go for a walk, for example, and use your exercise. You will for sure start thinking about your nutrition, which is another important natural healer. And on your walk, on your time alone, or even with a friend, you can start talking to your Creator. Trust, faith is another natural healer. So now you can see that just by choosing to use one natural healer, you are able to use all the 8 natural healers, right? And really strengthen your immune system. So I have something fun for us to do today because I want to see everybody moving. So I brought a little gadget here that it's fun, and I think everybody will enjoy using it a little bit. So I only have one, so it's gonna take a little time. So it's gonna be a little break for us also if we need to use the restroom. But I don't know if you have heard about the vibration plate. Have you heard about vibration plate?
Yes.
Yeah? Yes. You never heard about that? You're gonna like it. You're gonna enjoy it. It's fun, and I use it every day, and it actually stimulates movement of the lymphatic system. So it's really, really helpful. Like I mentioned, the chronic disease that I have, this is one of the tools that I use to help my lymphatic system move. And yeah, it's amazing. So I'm gonna invite everybody over here so we can use the vibration plate today. And you can use it at night to relax the muscles, but you can use it also for your exercises to actually make a challenge to do the exercise on top of the vibration plate. Yeah. So please come in. Yeah, I forgot the original because so for post-op surgery, I also recommend this because you can use it sitting down. For example, there's lack of movement, right? When we are healing from anything. So I'm gonna turn it on here. So when you go on the edges here, you have more of the vibration. But if you go in the middle here, you have less of the vibration. So if you are healing from a surgery, for example, you can stimulate the lymph flow just by sitting on a chair and really start moving, helping the fluid the lymphatic system to move. So, but when you are exercising, you can get on and just and really make it fun. Or if you are tired and you get home at night and tired and you just need to step out and you want to relax the muscles so you can have a better sleep, you can get on this vibration plate, right? And just really relax the whole body. And it's going to help you sleep better. Okay? So, you want to try?
I do. Okay.
So, hold here. You're not sure.
Oh, wow.
Isn't that nice?
Yeah, that's
And like I said, if you go closer to the edges, you have more of the vibration. And I forgot the remote control. But there are settings, so you can go higher or you could, this is the lowest setting.
Stop talking.
we already saw from her.
Please do. I knew everybody would love this. I love it. Isn't it nice? And like I said, if you go to the edges, you feel more of the vibration, or if you go to the middle, you feel less of the vibration. Okay?
I'm sorry, I didn't. And what is the benefit?
Well, you can actually benefit the lymphatic system itself. You're gonna also engage the muscles, and you can do your workouts on top of this also to make it challenge as well.
Oh, I see.
But you can also help the fibers of the muscles release. after a long day, for example.
I like this.
I like this.
Oh my god.
Nice, huh?
Yes.
It's a nice way to stimulate, right?
How long should we stay on top, the minimum, like to benefit from?
Well, you can do 15 minutes.
15.
I would recommend 30 minutes every day.
30 minutes. Oh.
I have to take my shoes off sometimes.
You don't have to.
That moves everything.
How
And
much
what
is a
I
unit?
do, remember, it's around 120, something like that. Yeah, I got it from Amazon.
Okay.
I got it from Amazon. And thinking about you specifically, what I do also, well, you can put it on top here as well, and you can put your arms there. Yeah, I like to do that with my arms as well. So,
This way.
Anybody else wants to try?
I do want to try.
You go, Iris.
I need to take off my You want to try?
You don't want to? Try. Okay.
Okay, you want to go first?
Take one. Okay, you can go first. I'll help. Oh, you can keep them on. You gotta keep them on. Okay, take it off. It feels better. Try it.
And this would be what I would call it just a relaxing mode. Just to stimulate the lymphatic. You want to try? Ooh. Nice, huh? You want to exercise in this?
Yeah. Mom, can we buy this?
You like it?
Okay.
Okay.
I'm done now.
Okay, come on.
You can use that. Yes.
Oh, that's awesome.
It feels relaxing,
Yeah,
doesn't it?
it does. So my hips are always tight, and I can feel them just releasing, just with that little bit of vibration.
Anybody else?
Yeah, come try.
Me? You have to try.
I have to take my
If
shoes
the other
off.
guys try it,
This is a wonderful plastic surgeon, Muslim. She came to support me. Can you believe that?
Yeah, go.
You have to
Put my
come
shoes
too.
on? Okay.
Yeah, you can. Ooh,
Yeah, that
nice.
feels good.
Yeah. No, it really helps to relax by the end of the day also.
Ooh, yeah.
You can increase the speed.
You
You
can.
can? Oh.
Uh-huh. On the remote control that I forgot actually, there's a speed that you can actually go right to running. So there's different, to running. So there's walk. Huh?
How do you run on that speed?
No, you don't run, but the way that it's engaging the muscles, it's like as if you were running.
Is this on Amazon?
It's on Amazon. I bought mine on Amazon, yeah. Anybody else? No?
I think that is good because if you can run, you can
Stimulate
Yes.
the muscles, yeah, it's the
Stimulate
same
the
way.
muscles.
Yeah.
it's really good.
That was it fun?
Yeah.
Wonderful. Yeah, we went to Pilates. Yes.
You like it, right?
So our next natural healer is the sunlight. Are we checking our vitamin D levels? Especially for post-op patients or patients that are healing from anything. We need to think about the vitamin D, because it's essential for the healing process. The reference range is, it varies too much, so it's kind of tricky. So you might actually be considered, within the right range, but if you are too close to the lowest side, for example, after surgery, it's still going to be hard for the body to control the phases of the healing process, because it's vitamin D that controls it. So inflammation, for example, if you don't have enough vitamin D, the body will probably stay in this phase for too long, and being on inflammation phase for too long can actually cause fibrosis. For example, seromas can also occur if you are for too long in the inflammation phase. So vitamin D is one of the vitamins that control that. So that's a very important vitamin that we need to make sure that the levels are good when we are going to surgery or when we are healing from anything. Okay? So with vitamin D and a lot of the vitamins that we need, sometimes supplementing can be necessary. So I really recommend for you to think about reaching out to a dietitian, for example, to make sure what your body is needing, because a lot of times supplements might be needed. Okay? And talking about vitamins, we're going to talk about nutrients, right? Because that's where we get our vitamins. Because even with supplements, we need to make sure that we are getting the vitamins from what we are eating, okay? So we're going to go over some nutrients facts here. So make it colorful, right? The more color we have, the more nutrients we're going to have in our diet. So making it also fun and colorful will bring all the nutrients that we need. So a lot of things that I see with patients post-op, and it's the worst mistake, is not eating, because it's so easy not to eat when we are in pain. So after, and especially after surgery, we don't feel like eating because we don't feel hungry, right? And because plastic surgery was usually because we were trying to lose some inches, for example, it might feel like a good idea not to eat, right? Because we're going to lose weight, so it feels like it's a good thing and we're not feeling hungry. But that's the worst mistake that we can make, because after surgery or when we are healing from anything, the body actually has, it needs more nutrients than when we are healthy. Okay, so that's one thing that I want you to keep in mind, because I see this too many times in my practice. The patients, they come to me 4 o'clock in the afternoon and they haven't eaten anything yet because they weren't feeling hungry. And even in the morning, because morning I always recommend my patients to stop eating at least 3 hours before they go to sleep, because that's another thing that can impact sleeping. So try to eat a light dinner. And I know here, especially here in the US, dinner is the bigger meal, right? But then having a bigger meal at night, it makes it harder for the body to actually fall asleep because it's working still, right? So try to change that. Try to do your bigger meal, for example, during lunch. And don't skip breakfast. I know that breakfast is so easy to skip, right? But especially when we are healing, we need the nutrients for the body to repair the tissue. Okay? So we're gonna go over about the no-nos, just because I have to. So alcohol is something that I always ask my patients to avoid at least for 3 months because it can really slow down the healing process. Okay. So, and it can interfere with the scarring itself. So please make sure that you can keep away from the alcohol. The next one, I'm afraid to show you because nobody's going to like me anymore. So it's coffee. It seems harmful, but actually, coffee comes a lot of times with sugar and cream, right? And that can really inflame the body. So, you know, if you can't stay without coffee at all, try to get to minimize it to at least just one a day, and with no sugar or no cream, okay? Because it can really impact blood flow and your sleep especially, okay? So some of my patients actually brought me this, this alternative here. I don't know if you guys are familiar with this. Yeah, have you tried? Yeah, you like it? Okay. So maybe this would be an option, right? A good option, because it has less caffeine, for example. Right?
What is it? Rice.
It's called Rise. Yeah, it has coffee also, but it has mushrooms in it. Yeah, I have never tried it personally, but I have some patients that tried it, and I looked at the ingredients also, and it seemed very good. So
it's called Rise.
Rise, yeah.
What is that?
Coffee alternative.
Yeah.
Has caffeine?
It has a little bit, but it has less. So if you can't stay away from the caffeine,
poison in the morning.
See, the doctor is not happy with me. So listen to the doctor. Stay away. I was trying to make them stay away, but, you know, so they still like me a little bit.
We found it.
But this is another thing that I want to bring to you, because it's important for us to read the ingredients. Because we are, usually we take a look at the nutrient facts here, but really what we should be looking is the ingredients, okay? Because this makes a whole difference. There's a lot of things that we see on the label that it looks like it's healthy, but then, and it's advertising actually as a healthy food for you to eat, but when you take a look at the ingredients, first of all, it's a huge list here, so you can, you know, be alert that it's not going to be too good. So the less items on the ingredients, the better, okay? And one thing that I want to bring to you is that when you're looking at the ingredients, the first ingredients are actually the most that it, how do you say it? It's the item that it was most used to make that product itself, okay? So, talking about ingredients, I want you to pay attention to the ingredients that you are using to seasoning your food as well. This week, actually, I went to the store with my mom, and she grabbed pepper and lemon and pepper, I think it was, right? And I asked her if she paid attention to the ingredients, and then when she looked, there was canola oil in it, right? So, and a lot of sodium as well. So take a look at the ingredients of everything that you're buying and every seasoning that you're using also, because it really makes a difference, especially when you are recovering. So here, and it's on your folder again, some options that you can have here to substitute, okay? Again, I prepared this slide here because I want you to take a look at the ingredients here. If you can't really recognize the words, you shouldn't be eating them, right? and everybody loves ranch, right? So, but if we pay attention to the ingredients here, the one that it would be still good for your body, if you read the ingredients, you can understand everything, right? So I want to encourage you to take a look at the ingredients. Here are also some options that you have on your folder to substitute. Soy sauce, for example, has a lot of sodium, and when we are healing from anything, you want to make sure that your sodium is not too high, okay? So we have in the market, we are so blessed in this country because we have so many options out there. You just need to know that they are out there, right? So this is why I wanted to bring this information for you. After surgery, a lot of patients believe that they have to drink isotonics, for example, and they are full of additives and sugars. So I brought you some alternatives. Coconut water, it has a lot of minerals that will help you healing from your surgery as well. Just make sure there's no added sugar to it, but there's a lot of options out there. And you can make your green juice, celery, cucumber juice. It's going to bring you all the minerals that you need. And I always ask my patients also to stay away from dairy because dairy really inflames our body, and when we are healing, we want to bring down inflammation as much as we want. And again, we have so many options in the market right there, right, for alternatives. Non-dairy milk, for example, if we need to use milk. But actually, coconut water, if you're going to make a smoothie, for example, you can use coconut water. You don't really need the milk to make a smoothie, for example, okay? But we do have options, thank God, in the market for non-dairy milk that it's going to bring nutrients for our bodies. And I like to talk about tea. I want you to make tea your favorite drink because it really helps overall. It helps a lot with swelling after surgery, for example. And there's a lot of teas also that you have that information on your folder that can help you sleep better, for example. Okay? So make it your favorite drink. Here are some of the teas and herbs that you can use to sleep better, for example. Okay? And to decrease inflammation. When I was doing, I'm still doing it, but working on decreasing my chronic disease, which is chronic inflammation, I used a lot of the teas, and it helped so much to decrease inflammation in my body. So I really didn't pay much attention to it before, but it really makes a whole difference. So, now you really don't like me, right? This processed food is so full of sodium and additives that I really want you to stay away from them, okay? There are alternatives that we can do, because I know to make a little sandwich, they seem so practical, right? And we know that we need protein, for example, after surgery or when we are healing. We need more protein when we are healing from anything, right? And we might be mistaken that this would count as protein, but it really doesn't, okay? So what I do, for example, my son likes and my family likes meat also. I'm a vegetarian, but my family's not. So what I do to give them the alternative is I make organic chicken and organic beef, and they can make a sandwich with that. Okay, so that's less sodium, less additives, and actually they are getting real protein also. Okay, and a lot of options, because you see how many colors here when you're a vegetarian, and when you're not, please join us. Because there's too many options, delicious options, right? That brings us the nutrients that we need, okay? And it makes the sandwich a lot more fun. So, enough about the no-nos, right? To achieve great tissue repair and lasting results. Huh?
Just going back to food, on the milk,
The dairy?
the dairy, how about yogurt? Is that good or?
Yeah, still. Yeah.
Still
So
like-
I have some options over
Like
there.
with yogurt, still bad?
Yeah, it's still bad. It's still gonna inflame your body because the lactose is very high on those also. So it's gonna inflame the body. Okay. So in a minute we're gonna have something fun again to do, and there's some items that I brought there, so you can take a look at the ingredients and really choose for yourself and see for yourself if this is really healthy for me or not. So that's why I want to encourage you to take a look at the ingredients, because then you're gonna know for sure if it's healthy, if it's really healthy. Because actually the yogurt that I brought, they're both dairy free. And one, you're gonna see that it's not healthy at all. Okay? So there's three main groups of food, okay? And I want you to think about those because they call it go, grow, and glow. So the grow is the ones that will give you energy. So our carbohydrates, okay? So a lot of the information out there make us feel scary about them, but they are the ones that give us energy, and they are. We just need to choose the right ones, the right carbohydrates, right? Because we really need them for energy. And the proteins. And when I talk about proteins, and especially after surgery or when we are healing, we need more proteins. And I'm not talking about meat itself, because the meat, yes, it has all the amino acids, and it's a complete, that makes the complete protein, let's say, but it's also hard for our body to digest. So it's actually bringing inflammation to our body. So there's other options also. For post-op patients, we always recommend them to make sure they're not eating too much protein from meat products, okay? Because they're also increasing inflammation, and we're trying to control inflammation, right? And then we have the regulatory foods, which will bring all the vitamins that we need. So let's talk a little bit about protein. Protein is crucial for post-op care. Protein will affect collagen formation, the tissue repair that we so much need after surgery, the immune function, and will prevent infection as well. So a protein-rich diet supports the wound healing. But one thing that I want to bring to you, and again, you have this information on your folder, so you can take a look at it again later. It's how much protein that you need. So talking about not eating, like we did in the beginning, a regular person, study says that we'll need 0.8 to 1 gram of protein per kilo. And when you are healing from surgery, you're gonna need more. So now you can really see that it doesn't make any sense for not eating after surgery, right? So I know it's hard sometimes, and I know you don't feel hungry, but you have to eat, because even though you're not moving as much, your body needs more protein, it needs more nutrients, so you can heal well, and you can have the results that the doctor gave you, okay? So I prepared this so you could compare, because it depends on the type of surgery that you had. You have some minor procedures and some extensive procedures also. And that may affect actually the amount of protein that you need, okay? And I want to point out to you, because this is very important, our body is only able to absorb 30 to 40 grams per meal. So if now you know that you're going to need more protein, that doesn't mean that you're going to eat more protein in just one meal, because your body won't be able to absorb all that. So it's just a waste, okay? So I did a little calculation here for you just to have a general idea. But for example, a person that weighs 170 pounds, they will need, and they had a minor procedure, for example, they will need 120 grams per day to have a good healing process. But you have to remember that you have to fraction this, because the body is only able to absorb 30 to 40 grams of protein per meal. Make sense? I want to bring whey protein to you, because since you saw that you're going to need more protein for your healing process, you're probably going to need to use some supplements to get all the protein that you need for the day. And whey protein is a good source. But I want to point out there's 3 different whey proteins out there, and they really make a difference on the impact that they're going to have on our bodies. So most of the proteins out there is concentrate, and the most tasty ones, for example, they are concentrate. And we can see here that it has less of the proteins of the other ones. It has more fats and more carbohydrates, for example. Okay, and usually they have more things added to it, like sugar, for example. So again, I want you to, when you're choosing your whey protein, to really take a look at the ingredients on that whey protein. And what I have learned and recommend is the hydrolyzed, because it's pre-digest, so the body will be able to absorb the protein much faster. And if you pay attention to the ingredients and it's only hydrolyzed, then you're only gonna have that protein, okay? You're not gonna have sugars added to it, for example. It has, the isolate is also good. It's a little more affordable as well, but the hydrolyzed can bring more benefits to you. So here's some foods. One thing that I want to mention for protein are seeds. Seeds are full of proteins, and we can get the proteins that we need by adding seeds to our meal, okay? Cherry for a snack at night, for example, 3 hours before you go to bed. You can have cherries because the sugar here, it's not going to spike up insulin as much. So cherry is a good fruit to eat at night also, and it helps stimulate melanin as well, so it's going to help you sleep better. So again, make it fun, make it colorful. Yes. She's repeating what I say. Make it really colorful, okay? Because here are a list of vitamins that you need to make sure that you have enough to go into surgery, for example, or to recover during your healing process. You need to make sure that you are giving your body all the vitamins, okay? And this, are you listening? Yes, okay. She's gonna have a procedure soon. So again, you have this on your folder, and you're gonna be able to read every vitamin and what it does in your body. And then I prepared a list for you with all the sources where you can eat those vitamins. Okay? So make sure that you are eating a lot of those foods so you can get the vitamins that you need. Magnesium we're going to talk a little bit about supplements, because again, especially when we are healing from something, we might need a little support, and supplements can really help us to get more of the vitamins that we are lacking, for example. And magnesium is one of them. But I want to point out to you that the form really makes a difference. So for example, you have this list here on your folder. There are forms of magnesium that really don't do anything for our body because the body can't really absorb it as well. So that's why I wanted to put a list of the magnesium that the body can really absorb and use it, okay? And when we are talking about sleep again, magnesium might be actually affecting the sleep because when we are lacking magnesium, sometimes it's hard to sleep, okay? So, but again, just like the food and the products that we buy, we need to make sure that the quality of the supplements are good, because a lot of times I see patients that are taking vitamins, but then when we take a look at the ingredients, either doesn't have enough of the supplement that it's telling, so it's not really giving the support that it should, or it comes with other ingredients that is really harming the body, okay? For example, I had a patient that was taking a supplement that had corn oil in it. I mean, why do you need to ingest everyday corn oil, right? So really pay attention to the ingredients because they do make a difference. So now for the fun part. Food tasting. I had some wonderful friends that prepared some food for us today. My mom have been working on a recipe because gluten is it's one thing that really inflames our body. And my mom worked on, it's gonna be amazing. I think you guys are gonna like it because it looks like bread, but it has no flour. And it tastes good. And she worked very hard on it. Thank you, Mom. So we're gonna have a little break for us to taste the food and use the bathroom if we need to. I want you to take a look at the items also and start reading the ingredients so you can see which ones that you would look in the store and say, oh, okay, this is not true. This is a false advertisement, right? Because I see the ingredients now and I see that this is not going to bring health for my body, right? And then we will meet again here in about 20 minutes, okay? For the last 2 natural healers that I want to talk to you about. All right? How are you? that will that will help me and share her experience with using moderation. Okay? So please welcome Paula.
Hello, everyone. It is a privilege to be here today with you guys and share a little bit of what I know. I was blessed that my parents, my dad is here today, but he knew about the 8 health healers even before I was born. So I have been living those for at least 40 years. I'm 40 now. So I really like it, and I think it's very important and makes a lot of difference in our lives. So that's why she asked me. I have a degree in psychology and business and a certification in Georgia, where they teach you natural treatments with hydrotherapy, massage, clay, and herbs. And then I did that because I lived there for all these years, and I think it's very nice to have those certificates and see how this thing works. It's very nice. And then moderation. Here we go. What comes to your mind when you think the word moderation? Some idea?
Moderation. Something hard to do it, not too much.
Drinking.
For me, it would be balance. That's what comes to my mind. Moderation is the avoidance of excess and extremes, especially in one's behavior. So having a balanced life, as you guys said, is the key for our success in other areas as well. When you think about moderation, after we talk about nutrition and all this delicious food, we think moderation comes only to nutrition, but that's not true. So, on my experience, balanced life itself is hard, but even harder when you have to balance work and other life activities as well. So, when I stopped thinking about having a balance in life, I actually realized that the most thing that bothers us or makes it that hard is work. Work impacts a lot of our balance and other life activities as well. So when I started my own business, I was enjoying my work so much. I love to talk to people, so I love it, and then I started working so many hours. And what happened? I stopped exercising, doing those natural healers, and then I had a lot of issues. Yeah, since I was working that much, I gained over 30 pounds. I lost some already, but I gained over 30 pounds. I have a picture for you guys to see. But this one, yes, I gained, here sometimes doesn't show that much, but I gained a lot, and I was being very skinny, so it was very, very hard for me. And then because I work in excess, I didn't have a balance in my life. So one day, I saw a picture, not this one, another one, that I couldn't recognize myself in it. And I said, what I'm doing with my life? And then I decided, slowly, let's go back to my life, start very things like Elayne said. I even go to her, she remembers, she couldn't even touch me. She touched me, and I was screaming. And she said, I'm not putting pressure. I said, yes, you were. But my whole body was inflamed with all this stress and everything for working and not having a balance in my life. So what I did, I started going to the therapist to help me emotionally. Then I started reading about Proverbs to help me with wisdom in the Bible. And then I started going back to the gym and slowly starting doing everything that I knew for a long time. And I was able to lose some weight again. And it's not about the weight itself. It is about your feeling good. Like not having pain, like Elayne said, my body was inflamed. So that's what's most important for me. I don't want to be inflamed, and I want to be good to do the things that God taught me how to do it. So I delete everything here. So as I was saying, everything is good, but in excess can be harmful. As we learn, to the sun, it's very important to us. But if we do too much sun, it can cause is skin cancer. So everything we have to do with balance. So God tell us, love your neighbor as you love yourself. That was very hard for me. But unfortunately, we love to take care of everyone, but not us. We put us as last. So it's important to us to take care of us first, so we can take care of our family, our friends, our work. And I learned, don't change this order. Do it yourself first. Exercise, take care of your body, because your mind is going to be good. Then you can give your 100% to your family, to your friends, and even to your work. Balance is necessary in every aspect, as physically, mentally, and spiritually. So I invite you today to take a deep look in your life and see which areas you need to balance. And do that change, because our most precious gift that God can give us is our body. So ask God to help you balance your life. Learning about self-knowledge will help you recognize each area your life is take your life balance away. So you have to stop, learn yourself what things that you know, or activities or whatever, it's take your balance away and put it back in that order that helps you to be better without any inflammation in your body, and be better with your life, because when I was sick, I didn't have energy. I have pain all over. If you look my hospital, my medical history, they told me I have over 10 illness because I was so inflamed. They did, you have this, you have surgery you need surgery for that, for my hands. And I said, I'm not gonna do any surgery. I'm gonna try the natural first. So self-knowledge, what's inflaming you? So I knew what it was. And then slowly, it's not easy, but slowly I was able to get back on track. So start change one step at a time in your life, and slowly you start to see the results. Mine experience took over 2 years, exercising every day, doing hydrotherapy. I was talking to some of the people here, and I was saying that every day I go to the gym. After I go to the hydrotherapy, to the jacuzzi, I go to sauna, I go to the pool, and I do those therapy that help relax my body, because I know mine is the stress, too much work. So those natural healers help me to get back on track. It's not easy. I'm not going to tell you that it is, but with God, and it is worth it. Today I can tell you after 2 years that it's not only about the weight, but it's about the feeling that you have. Today I have energy. Before my friend, let's go to the gym at 5. No. Today I go at 4:30 in the morning, and I have energy that I didn't have on my 20s. So yes, I didn't have any. So it's about having this balance, eating correct, eating the good food, trying to avoid everything that inflames you. So I was 2 months without any sugar. So all those changing helped me to get back again on my feet, get more confident, and get better to do what I love to do, that is helping people and working with them. So I'm feeling much better. So our body is the temple of the Holy Spirit. So please take care of your body. Take care of them as your golden, because them is what makes a difference whatever you do. That's it. Quer o microfone?
He's trying to make us more nervous. That's what he's trying to do.
Okay.
3. Look at that. This is amazing. Good, good.
Now you can sing.
Thank you, Paula, again. Thank you so much. Isn't it wonderful to know that our temple is, our body is a temple, right? And then we are allowed to take good care of it, because a lot of times we feel that we're supposed to take care of everybody else but ourselves, right? So allow yourself to take good care of yourself, okay? And I want to take you back. It's a little stronger, the image that I'm going to show you, but I have to take you back to my story when I was a breast cancer survivor patient, because I want to show you the difference that using the 8 natural healers really does to your body, okay? So like I said in the beginning, I had 8 surgeries during that period because radiation was very aggressive and I had pretty serious burn on my skin. And the doctors actually told me that that was going to happen, and they told me a lot of things, scary things, because they were trying to prepare me for the worst, right? But they told me that those side effects would last for life. They told me that from the burns, I would lose flexibility. My skin, they actually said that it would feel like leather for forever. And I want to show you how it is now, okay? So this is how it looked like when I was going through treatment, and this is how it looks like now. You can't really tell that my skin one day was burned like this, right? And I'm gonna go back so you don't have to look at that very much. But that they gave me a cream to use during the time that I was going through radiation that I didn't use. I used only the first day, and I didn't use it at all. What I used was aloe vera, and that really helped throughout my skin, and it helped me to support while I was going through it. And you could see how my skin looks like now, because it looks perfectly fine. It doesn't feel like a leather. I have all the range of motion from it because I was using the 8 natural healers and other holistic treatments that I learned also during that period that I used. Okay, so I brought this to you because I really want to encourage you to use the 8 natural healers, okay, because they do make a difference on the healing process. And I'm going to go to the last natural healer, which is trusting God, your faith, right? And I need to ask you permission to give my testimony also, because he brought me here today. What is faith? Faith is being sure of what you hope for and certain of what you do not see, right? And when we go through trials, a lot of times it's hard to lose our faith, right? Because we're not really seeing anything, right? And it seems like there's nothing there really. And getting this diagnosed, this cancer word, really feels like a death sentence, right? And you lose literally, right? Everything, and you don't know how it's going to be. So when I was diagnosed, it was back in 2009. It was December 24th, so we were going to have Christmas Eve with the family, and they told me in the morning that I had cancer, but we did the mammogram and we had ultrasound right after, because then, you know, all that movement of doctors being scared started. And right there, he told me that I had cancer, but we still had to do biopsy. But he was sure, you know, he didn't have any doubts. He was going to do the biopsy just because we had to. So, but I didn't tell. I told my husband and I told my brother that day, but I didn't tell anybody else because I didn't want, especially, you know, my mother, my parents, to be too scared, because I wasn't sure if I had it, even though the doctor was sure, right? So Around 2 weeks later, when he actually called me to give me the final diagnosis after the biopsy, I was in my office, and I used to sell granite, so I was sitting in my desk when he called and told me that I had cancer. So I went to the bathroom, and I did this desperate prayer. I'm sorry, I'm going to try not to get too emotional, but it's just overwhelming for me to remember that the Creator knows my name. Yes. Because I went to the bathroom and I did some specific questions in my prayer. You know, it was a desperate prayer that when I went back to my computer, it was amazing because everything that I had asked, he answered. So I'm here today to testify that he hears and he knows your name. Because I don't know if any of you remember MSN. Do you remember? Yeah, because this was back in 2009, 2010, because it was already 2010 when I really received the final diagnosis. So that window popped up on my computer. And when I sat down, when I came back from the bathroom and did that prayer, he showed me that he was really listening to me. So I say that I received a text from God. Because this is the exact text that I read when I went back to my desk. And I sat and I looked at my computer screen, and MSN had popped up. And this is what it said. Elayne. He called me by my name. And he said, I am holy and truthful. The first question that I asked him was if he was truth. Because I grew up hearing about him, right? But there I was in a situation that I didn't know what was going to happen. At that time, I was the primary income in my house. My kids, my youngest one was 4 years old. My oldest one was 10. And I had no insurance also. I didn't have health insurance. So I didn't even know how my treatment would be like. The doctor that gave me the diagnosis, he was going to do the surgery just because he was the one that found out. But he was just what's the word? He was just going to take the cancer out. In other words, he was just going to do the mastectomy. And I found out that he wasn't a breast surgeon. He was a surgeon, so he had to do it because he was the one that discovered. But he was just going to do the mastectomy even though he had never done a breast surgery. So in this verse it says that I hold the key, and when I open the door, no one can shut. And he had the key for my treatment. Because after we discovered that, God opened a way for me to receive the best care. And in a week, I was with a team of experienced doctors taking a look at my case and design a treatment for me, even though I didn't have insurance. So he answered me a lot of things that I didn't even know, and I could see each one. One of the things that he answered in this text was this part here, that I later learned that the friend that he used to send me this text actually erased this part 3 times before she decided to send it. Because it says, listen to what I say. Those liars that are against you, I will make them fall down at your feet and see that I love you, Elayne. I had asked him if he loved me. So even though it seems like a weird verse of the Bible to send a friend in the middle of the day, right? And that's why she erased it, because it didn't make sense to her to send me a text from Revelations, first of all, because nobody sends an inspirational verse from Revelations, right? But she had this feeling, and she obeyed, and she listened, and that's all she texted me that day. Nothing else. She didn't say nothing else, just that. And it was just amazing to hear later on that she erased this part 3 times, but she felt like she needed to put it there. And then I told her why it was, because one of the questions was if he really loved me. So I'm here to testify that he knows you by your name, okay? And I know it's hard sometimes, and we lose our faith. But I'm here to testify that he's, like he says here, I am holy and truthful. And I love you, each one of you, okay? So I have the pleasure today also here to have this friend that sent me this text. I encourage you to have different mentors, in your life, because we all need it. And she's my good friend, and she's one of my best spiritual mentor. And after that experience also, she went back to school, and today she's a chaplain, and this is what she does. She helps people, mentoring people on their trials. So if you need help, I also want to encourage you to find a mentor. And if you want to speak to someone today also, she's here for you, okay? So she was there for me also, and I thank God for that. So thank you so much. I want to leave you with this verse, Romans 8:35-39, because there's nothing that can separate us from his love, okay? Thank you so much. Thank you all for being here. And you're welcome to have more anti-inflammatory foods. Thank you all.
It was a great workshop, Elayne.
Thank you
so much.
I want to thank you. Please come in. I want to thank you. Så känner jag alldeles ladd för